Hello and welcome to the Queen Elizabeth Patient Podcast. My name's Caroline Tweedy. I'm one of the clinical nurse specialists at the Queen Elizabeth. I'm today here with Dr. Peter Blackburn. Hello, welcome Peter, and thanks for coming along today. Peter, is it possible you can just tell us a little bit about yourself and your role and a little bit about what we're going to talk about today as well?
Okay, thank you very much for inviting me. I work as a clinical psychologist in Gateshead in palliative care and breast cancer service. And today we're going to look at motivation, particularly staying motivated during chemotherapy, which for some can be quite challenging and grueling, and to be able to stay the course during this period.
I think the thing with motivation during chemotherapy is often the obstacles that are in the way, and often probably the biggest one is that fatigue, and that get up and go is often diminished.
Yeah. Okay, so what we'll do is consider what motivation is, what some of the factors are to becoming and staying motivated, think about the obstacles, and then thinking about some solutions to those obstacles. Does that sound okay?
That sounds good. And I think, like I say, it's just putting that strategy, that I suppose small steps to trying to achieve that motivation. So, explain, what exactly is motivation?
Okay, yeah. So motivation is around the effort, energy or investment we want to put into something to either achieve or maintain on a given course in our lives. And it can be from exercise to running that marathon, dietary changes to lose weight, etc. And there are a number of qualities or factors in motivation, and there's loads of theories trying to explain and understand motivation. There are some key factors or qualities that a bit of research has found are important, and these are the internal motivating factors. Doing something that means something to ourselves, gives us enjoyment, a sense of pleasure, a sense of mastery. The next factor or quality is doing something because it is important and has a recognised value. The third one is doing something to avoid feelings of, say, guilt or shame, and that's more of an avoidant approach. External approaches are doing something to receive some kind of reward from others, say praise, or avoiding, say, criticism. And the literature will say that the highest or the best motivational factors are the internal ones, the ones where you're doing it for yourself and you know why you're doing it.
So I think a lot of patients, when they're going through chemotherapy, it's kind of, I suppose it's kind of reflecting on what do they want to get out of it, But I think sometimes it's like you say, it's a strategy of how do you do that? Because I suppose motivation's all about achieving a goal.
It is, and if we think about those goals, the more they're linked to human needs, the more likely they'll occur. So if people have a sense of agency, which is that they have some choice and control in what they're doing and why they're doing it, that's an important factor. They feel some sort of level of competence, which means that they feel skilled or effective in whatever the change behaviour is, again is helpful. And then how much they can relate to it, a sense of connection to the idea of something new, alongside a connectedness to others who might be engaged in that.
So, you've got somebody that's, coming towards the end of the chemotherapy treatment, probably fatigue's at the lowest. And for them, the goal is to maybe just leave the house, which is maybe something they haven't done for a couple of weeks. So if we're wanting to get that motivation to get them out the house, what kind of strategies would you put into something like that?
Well, I think leaving the house or doing anything that's challenging and thinking about motivation, it's the reason why. That needs to be at the front of people's minds. and the more of it's an approach goal rather than an avoidance goal. So an approach goal is getting something that we want rather than avoiding something we don't want. So the more it's an approach goal, again, that increases the chances of it happening. So it's really important to understand the reason why. The Nietzsche quote, "He who has a why will find any how." So the person who knows why they're going to do something will achieve it somehow. From a psychological point of view, we would think of it in terms of what's a person's values, what's important to them, what's deep in their heart, what gives them meaning in this behaviour. And the more meaning they have, and the more sense this is for them, the more likely it will happen. If they don't see so much meaning in it, and they're doing it for others, then motivation's not going to be high. It's then, if you think about, say, specifically for fatigue problems, then it's about pacing that activity, so that they understand how to allot energy to given activities and being able to decide what's the most important things to do with their energy. And pacing activity involves time limited behavior, which means that they stop an activity because it's time to, not because their energy levels are depleted. That's too late. So, and you'll get potentially into a boom to bust way of living, which means you'll have a good day, you'll do loads, and then the next 3 to 4 days you'll be absolutely wiped out. And typically what can happen over a few weeks and months is that people then will be able to do less and less if they get into a boom to bust.
I suppose it then sort of just spirals.
Absolutely, yeah. So being able to pace and think, okay, I'm going to do a small amount of activity, and then I'll change that activity to maybe rest, relaxation, meditation, and then another activity that may require an increase in energy, and it's those little steps. So I think there's something around anticipating obstacles, thinking about what they might be, and you're right, fatigue is definitely one of them, and then coming up with solutions to those.
Because I think sometimes as well, where I sometimes can get in the mindset of, if the negative things that can maybe happen, if we do that thing, we're often sort of in the worst case scenario, and I think it's trying to turn it on its head and thinking of what the best might come out of making that decision and being motivated to make that change.
Yeah, one of the obstacles for motivation is pessimism and making that negative prediction. And obviously the flip side to pessimism is optimism. Optimism can be learned, even for people who don't feel optimistic. It can be learned. It's not easy, but it's trying to weigh up the possible outcomes, good and bad, and finding probably a middle ground as the likely one.
I was actually reading something about practicing this positive thinking, that it's like, I suppose, a muscle in the body, that the more you work at it and the stronger it gets, the more sometimes that mindset becomes a little bit more automatic rather than something that you have to maybe think about. Is that in your experience?
I think positive thinking is a very broad term. And if we think of it in terms of optimism, yes, that's something that can be learned. If we're thinking about it in terms of it'll be all right, I'm strong, I can get through this, then the evidence is a bit limited, mainly because if people don't believe they're strong, then they won't succeed, and that'll add another obstacle. So positive thinking in terms of optimism, yes, particularly if people think they have a choice and control in that journey they're on, I think is where I would place it. And I encourage people to think about positive behaviour. What can people do rather than think about their situation?
And sometimes as well, especially with the current circumstances of the pandemic at the minute, that a lot of patients are isolated, so making decisions to be more motivated are hard on their own. But sometimes one of the strategies, I suppose, is bringing somebody else on it. So if we take back the person that wants to leave the house, is arranging, I suppose, to meet somebody so that you've got like a contract. Sure,
I think that sounds good. I think a buddy system. We think about there's cancer buddies is an initiative now to help people get through chemo, but just the whole process of treatment. So being able to find like-minded people who have similar goals, similar values, is going to create energy.
Yeah, I suppose that's why, the popularity with things like Macmillan starting like walking groups and things like, obviously things like that are currently on hold, but hopefully when life comes back to normal, the social side of things can really help.
It's very powerful, and the research will support that social support within cancer is almost essential, but through life generally. And through this period of living with COVID, we've seen where it works really well for people, and where people suffer and struggle when they don't have it and they need it. And a lot of people are what we call social animals. They want that connection, very much face to face, being able to touch and to hug, and all this has been robbed for a lot of people, and that leads to a struggle for that human need. Some people, they thrive because they like being on their own, that's them.
And I think that's probably the whole reflection of what's currently happening is that everybody is so different, and we all deal with all of these struggles completely different. But, to go back to that person that's struggling on their own, they have to make that decision on their own of when they're ready to make that, if you know what I mean. Yeah,
I think there's something around keeping connected with what is important here. What is my reason why? And trusting yourself to make good enough decisions, or even the best decisions in the circumstances that they're in, and letting go of seeking the perfect decision, and letting go of uncertainty, of not knowing if this is the absolute right one, and making the best decision, or good enough, whatever the phrase is, in the circumstances that they're in.
I think I read something about, if you're going to try and fall forward, and maybe learn from that, and like that strategy maybe didn't work, but there's something, another strategy that you could put in place for the next time.
Sure, yeah. So coming back to motivation, I think there's something around reminding the person what are the advantages of doing whatever the behaviour is. It might be chemo, it might be losing weight, exercising. What are the advantages of this? Then there's something around the level of intention. How much do I want this? How important is it? Then there's, I think, looking, as I said about optimism, how much of a positive outcome can be achieved in whatever I'm doing.
And is that sometimes that strategy good to write it down? Is there some research behind that?
There is, at the back of my mind, and I don't know why this is, but I think if you write down a goal, it increases the likelihood of it happening by 23%. Now, that feels like an ancient figure. I bet there's newer research on that.
But there's certainly an advantage to writing it down.
And a publicly stated one. So if you say it out loud in front of somebody, again, that increases the likelihood of it happening. And another factor to think about is what concerns you if you remain doing the same behaviour.
And I think it's the black hole, isn't it, of how do you get out of that?
Yeah, and if what you're trying to balance up and try and create a bit of space between is what's good about the new behaviour or what's good about going through chemo versus what concerns you if you don't go for chemo, and seeing that there's benefits here, and there could be potential costs. And likewise the same for, say, weight loss. What are the advantages for it versus what concerns you if you remain at that weight? And again, as I've said before, reconnecting on a daily basis in a way that's as fresh as you can make it. Why am I doing this? Connecting with what's deep in your heart, what's really important, that makes a big difference. And the more we are involved in a new process, like weight loss, giving up smoking, exercise, or chemo, that we get into that new way of doing things. And sometimes we can lose sight of why are we doing this? What's the reason?
So is it a good idea to keep, these goals sort of short term? So maybe if somebody who's looking at weight loss is maybe right for a week, I'm not going to have snacks in between meals, and I'm just going to do that for a week. And if you can achieve that, then maybe progressing onto something, another short-term goal. Do you think these sometimes help to the bigger picture?
I think it might be in each to their own. Thinking about, say, smoking cessation, there are some people who just want to stop, full stop, and others who want to wean themselves off, either reducing the number of cigarettes that they smoke or patches or vapes. And it's a bit by bit approach. I think that there's always work out what is the end point, what's so important about that, creating milestones to get towards that, and then stepping stones to those milestones, which is what you're saying. Those, what daily can I do that moves me towards that milestone, which could be at the end of the week. And when I look at that milestone, yes, I'm this closer to that.
And I think, again, it's for the patients during chemotherapy, these milestones are maybe if you're on 6 cycles of chemotherapy, that each cycle is a milestone. And I think, again, it's actually, I don't think patients appreciate the hard work that they're actually doing anyway, just to get through a diagnosis, get through surgery, and actually on that pathway of chemotherapy, it's an enormous amount to kind of deal with. Yeah. And I think, patients, maybe think too much of themselves of what they have to do, or think they should be every day jumping out of bed and being able to do A, B and C. Sometimes we put a lot of pressure on ourselves to try and conform with what we think we should be doing. I
think so. I think there's a sort of internal competition or comparison, which is comparing myself to before I was diagnosed or a weller time compared to now. And that can be an unhelpful one if we're coming up with repeated negative evaluations in the sense of I'm failing. And then there's that competition or comparison with other people who've got the same disease, going through the same treatment, and they seem to be progressing faster than we are.
We see a lot of that. We see a lot of people comparing, somebody from down the road that, doesn't feel like that, and sometimes feel a bit of a failure that that they don't feel like that. So
and it's human nature. We're good at making comparisons, but it's also the downside of our mind too. So there's something about kindness and compassion to the self, that this is a big challenge, and it's a new one and needs to be approached with patience and perseverance and inner kindness. And I'm reminded of a patient who likened chemo to a boxing match, and while she'd never boxed, I thought it was a good metaphor. It made sense, which was kind of round 1, you're fresh, you're ready to engage in this, and then round 2 comes, which is the second cycle, still maybe a bit fresh, but you're carrying what you've gone through in round 1, and by round 6 you're carrying all of the bruises and batterings you've had in the previous rounds. So by the final cycle, it could be quite challenging, and to be able to understand that and anticipate it can be, help reduce that sense of failing. And I think during difficult periods, it's working out what's essential and prioritizing that and letting go of what's important. Sometimes people elevate important stuff to essential, and they don't need to. And it's really working out for the person, is this essential? Does it need to happen today? And if the answer is no, it doesn't, and you haven't got that energy, then let's just park it and see what tomorrow offers.
And I suppose that goes back to the boxing match, if sometimes feeling that in some of the rounds that you're failing, but actually you are moving forward.
You're still in the match. Yeah. You may have got knocked over, but you've stood up and gone again. It's helped some people, and I've shared this lady's idea. If we think about the fighting metaphor generally, there is, I can't remember if it's research or not, but generally speaking, the fighting metaphor doesn't work. So people who say they're fighting with cancer tends to add to the suffering because they may not succeed in that fight. And therefore it's better to think about it in terms of living with. So understanding going through chemo might be like a boxing match. If that works, great. But the whole fighting cancer metaphor, it looks like it doesn't work as an idea. In chronic pain, they talk about not fighting it and more about dancing with it, how to be with it. And again, some patients have found that really helpful metaphor shift.
So Peter, we've talked a lot about obviously motivation during treatment such as chemotherapy. Would you sort of be able to kind of bring it down to maybe 3 strategies that you would advise?
Yeah, I think the number one strategy is holding that reason why, keeping that at the forefront of the mind, daily connection to it. Why is this important to me? And that's the second bit, it's to me. So let's think about those internal factors that we talked about at the beginning. The more we're doing something for ourselves, the research will say it's going to increase motivation. Alongside recognising the value in it, the benefits in that, those 2 factors, the higher people rate that it's for me and it's important, it's more likely to occur. I think there's something around the more choice and control people have in the behaviour, the activity, that's going to increase the chances of motivation, alongside that sense of ability, competence to do whatever it is. I'm going over 3, I'm sorry. Having a shed loads of patience and perseverance.
And it's never just going to be one straight line, is it?
No. So there's going to be obstacles, and it's been able to roll with it and been able to see things as slips, not massive falls.
We're falling forward. That's the goal.
That's great.
But that's, I mean, like they say, there's a lot of food for thought there. You know, there's some strategies that I think are achievable. Don't be too hard on ourselves. It is really what's screaming through. And that the challenge that you've already, you know, if you're already on chemotherapy, that's a challenge in itself. So, you know, some really useful stuff there, Peter. But thank you very much. There's a lot of other podcasts that Peter's also done as well that you can find in the information hub of the podcast. Thank you very much, Peter, for coming along.
Thank you for inviting me.